Hi, I'm Dr. Ken Berry, family physician with almost 20 years of clinical experience. In this short video, I want to talk to you about a diet that can help you lower your blood pressure and even reverse hypertension. So if you have high blood pressure, hypertension, or prehypertension, you're going to want to stick around to the end of this video to find out exactly what you need to do. Now, if you've been to your doctor, you've maybe been recommended the DASH diet or a low-fat, low-salt Mediterranean type diet, and you've noticed several things about these diets, and we're going to talk about that first and then talk about the diet that in my clinical and personal experience, I've seen reverse hypertension, lower high blood pressure better than any other diet that I've ever dealt with. Now, if you enjoy videos like this, please take 1 second and consider clicking that subscribe button and the little bell right beside it so that every time I get a bright idea, you'll be one of the very first to know. Now, if you've been to your doctor or other healthcare provider, or even talked to your mama about your hypertension or your high blood pressure, you've probably been told to follow one of two diets. First is the DASH diet, which is a very, very low salt, low fat, low saturated fat, high carbohydrate diet. It's very, very hard to stick to a low sodium diet because human beings are salty mammals. We love salt and we actually need lots of salt for proper and optimal function. And so it's very hard. It would be like telling someone, hey, you're breathing too many times a day. I want you to start breathing 5 times a minute, and that's it. And you're just going to have to, you can't be a glutton or a sloth. You've got to suck it up and be a man or be a woman and breathe 5 times a minute. That's dumb. You might try that for a few minutes, but you can't stick to that because you're hardwired to breathe from 14 to 20 times a minute, depending on your age, gender, and condition. So you can't breathe 5 times a minute. It's not a failing on your part. It's a failing on the doctor's part that gave you that stupid advice. The same goes for a low salt diet. Human beings are by nature low carb, high salt mammals. That's what we are. We live on lots of fat and protein, and we need lots of salt in order to function optimally. And so when your doctor puts you on a super low salt diet like the DASH diet, you feel miserable, it's hard to stick to, and you give up, and then you blame yourself for the failure. Another diet that's pretty popular right now among healthcare providers, dietitians, and nutritionists is they call it the Mediterranean diet, but actually it doesn't look anything like a diet that ancient Mediterraneans ate. It's a very low-fat, low-salt, high carbohydrate diet. And they'll say, eat lots of fruits and vegetables, lots of whole grains. But all of these things will actually make your blood pressure worse, as I go into more detail about that in other videos. The research shows that the DASH diet or the low-fat, low-sodium Mediterranean diet might lower your blood pressure 2 or 3 points. Not great, right? I mean, for all that trouble, you would think it would return it exactly to normal if you were going to have to basically semi-starve and salt restrict for the rest of your life. You would want a normal blood pressure from that diet, but this diet does not give you that. You get maybe 2 or 3 points lower. Most people, it's super hard to stick to either one of these diets. Most people fail after a few weeks or a few months, and they blame themselves instead of blaming the person that gave them this terrible advice. There's very little fat loss on the DASH diet or the low fat, low salt Mediterranean because you can't stick to it. You keep cheating and you can't help it because you're hardwired to eat fat and you're hardwired to eat salt. In both of these diets, they really talk about portion control and how you should limit your portion size and count calories, and none of that stuff gives you any useful advice because what you want to do is eat until you're full and then stop and then go live your life, and then when you're hungry again, eat till you're full and then go live your life. That's what we're supposed to do as mammals. But these diets don't let you do that. So instead, let's talk about another diet that I have used in my clinical practice, and I've had people come off 1 or 2 or even 3 blood pressure medications as their blood pressure quickly returns to normal with this diet. There are very few people who will still have to be on 1 low-dose blood pressure pill rather than the 2, 3, or 4 that they used to be on, but they consider that to be quite a success. This is a low-carbohydrate, whole food diet that lets you salt to taste, because it's actually another white crystal that causes your blood pressure to stay chronically elevated. not the salt. This diet, what you're going to do is you're going to limit yourself to 50 total grams of carbohydrates or less a day. Some people may not need to go lower than that. Some people may need to go down to 20 total grams a day, but I would start at 50 and see how you do there. You're going to eat 2 to 3 discrete meals a day. So if you can get by with 2 meals a day, I would prefer you do that, because what we're trying to do is keep certain hormone levels low normal, so that your blood pressure will come down. The 2 diets I talked about above are going to keep your insulin level chronically high, your cortisol level chronically high, your blood sugar chronically high, and your aldosterone level chronically high. That's what the DASH diet and the low-fat, low-sodium Mediterranean diets, that's what they're going to do for you. Not only does that make you feel miserable, it increases your risk of chronic inflammation, chronic heart disease, it keeps your blood pressure higher, so that's just not going to work. So with this low carb, whole food diet, some people call it low carb, some people call it keto, some people even turn down the carbohydrate intake enough to where it's a carnivore diet, but some variation of that diet is going to get your blood pressure down way more than 2 or 3 points, which is what you're going to get from those other diets. Now, what I also want you to have no snacks in between. And you're thinking, but what if I get hungry? Well, here's how you're going to avoid that. When you eat your first meal of the day, and we'll call that breakfast, whether you eat it first thing in the morning or whether you wait till noon or later to eat that first meal, you're going to eat as much fatty meat and veg, salted to taste. You're going to eat until you're comfortably stuffed. Then you're going to stop eating. And then you're going to wait as many hours into the day as you can, and you'll have a second meal, again, where you eat lots of fatty meat and veg and salt that to taste until you're comfortably stuffed. Then you'll stop eating. Now you can see with that kind of diet, if you're getting to eat till you're comfortably stuffed, rather than portion control or calorie restrict, you're not going to get hungry nearly as often. And also the fat and the protein in those meals are going to help keep you satiated for many, many hours more than a high carb, low fat diet like the Mediterranean or the DASH. Also, I want you to go at least 16 hours a day with not eating at all. And that may sound terrible to start with, but consider you already spend 7 or 8 hours a day not eating. That's when you're asleep. All I want you to do is keep slowly tacking hours of not eating right after you wake up and then right before you go to sleep. And so keep increasing the amount of hours that you don't eat until you get them up to 16 hours a day. Again, this is not going to be nearly as hard as you think it might be, because you're satiated with all the fat and protein that you ate in those 2 or 3 meals that you ate during the day. So next is I want you to do no snacking whatsoever, because you're not going to have to snack because you're eating until you're comfortably stuffed. Now, what this is going to do, this diet is going to help keep your blood sugar very low normal. It's going to help keep your insulin very low normal. It's going to help keep your cortisol, your aldosterone very low normal. And these will help you get rid of inflammation, get rid of all the fluid that you're holding. It'll allow your kidneys to pee off the fluid that's increasing your blood volume, that's giving you the blood pressure problem. Does that make sense? And this diet, I've seen this diet lower people's blood pressure 20 or 30 points back towards normal. Some people, when they start this diet taking 3 or 4 blood pressure medications, they have to stop 1 or 2 or 3 of those, or they'll start to have blood pressure that's too low. That's good. That's a good thing. That means that you no longer need that blood pressure medication. Now, anybody listening to this, if you've used low carb, keto, or carnivore to lower your blood pressure or lower it all the way back to normal, and you've been able to stop medications, I want you to do 2 things for me to pay me back for helping you understand this diet. First of all, I want you to comment your story down below. How many medicines you started on, what your average blood pressure was, and then you started low carb, keto, carnivore, and now how many medicines you're on and what's your average blood pressure. Because many people are scared of this diet. They've seen news articles or news programs that have scared them about this diet. They need to hear your story so that they can be comfortable enough to just try this diet for a month or 2, because no diet's going to hurt you if you just try it for a month or 2, right? Second thing I need you to do is share this video with a friend or a family member who has high blood pressure. That literally could change their life. It could actually save their life. Okay, guys, this is Dr. Barry. I'll see you next time.